Right. Good afternoon, everyone. Today, my presentation is level of expression on selected genes in protein kinase pathway in the intracellular signaling cascade of RAF and Merck pathway in oral squamous cell carcinoma. I am Sajit Edirisinghe from Faculty of Medical Sciences, University of Sri Jayawardenepura. So, when we talk about the oral cancers, it is one of the leading cancers in Sri Lanka and number one cancer in men in Sri Lanka. Despite of the type of modalities and the treatment options, we have seen that there is a high chance of recurrence of oral cancers after the surgical excision or after the drug treatments. So, uh, in this case, we have obtained 14 samples from the oral malignancies, and we have confirmed it with histologically, and the pathologist has seen it, and we have confirmed it having oral squamous cell cancers. And at the same time, we have taken another 14 samples from 1 centimeter away from the tumor free margin. So it's a tumor margin, and we have taken it 1 centimeter away from that tumor. So, and we have done the histological confirmation also on those tissues. So we have in the histologically those tissues which we took 1 centimeter away from the cancer is histologically free from malignant changes, the nuclear changes and the cytoplasmic changes. So, in those both tissues, the cancer and the normal tissues, we have done the focus gene array for selected intracellular signaling cascade of RAS, RAF, and Merck and ERK pathways. Before going for the study proper, initially we did a small uh, study to find out the selected reference genes, because now in commercially we have already have nearly 32 selected genes which we can use as reference genes for this real-time PCR analysis. So we took that panel and run for our sample to see whether what are the most suitable reference genes for our study out of that 32. So from that study, as you all can see in this chart, the stability values, we have selected the GAP-DH and HPRT1 and RPL30 as this reference gene. So we selected these three selected reference genes, and then we ran the proper real-time PCR with those reference genes. So as you all can see on this side, this chart, we have seen an increment of the selected genes in this RAF, the RAS family, as well as the ERK pathways, and the genes has increased. Gene expression has increased. But if you all can see clearly, on these red color dots are referred to the cancer, and these blue color dots are referred for the normal tissue. Even though we have selected and we have confirmed it histologically, those tissues are histologically normal. What we have taken from 1 centimeter away from the tumor margin, but we have seen there's no significant difference between the cancer tissue and the surrounding the other area, even though those are histologically normal. So we have seen it throughout uh, the all the cancer genes that we have selected, as well as for the normal tissues. As you all can see, we have seen an nearly 100-fold increment in the NRAS gene as well as the CRAF gene. But when the tumor tissue is also increasing in the gene expression, that the normal tissue that we have selected as histologically normal, it has also has gone up. So we would like to conclude. So because of even though we have selected it as histologically normal, but there are genetic changes associated in those tissues. So we can come to a conclusion, even though this is a part of a huge study, uh, the field cancerization effect. So even though we look at as histologically normal tissue, but there can be genetic changes associated with the tumor free areas. uh, that could be one of the reasons that could be there is a recurrence in after a surgical excision in those patients. So I would like to suggest, uh, this study is not enough to come for a 100% conclusion, but this study is a suggestive to think about doing a genetic study at the tumor free margins, even though it is histologically normal, to check whether any gene expressions are, or the genes are expressed, or selected genes are expressed in these tumor free margins. Because if we select it, so then we can go for another resection or any other specific treatments if there are genetic alterations because of this field cancerization effect. Thank you.